Hi, my name is Chastka, and I'm a pelvic floor physical therapist at Lady Bird Physical Therapy. And today I'm going to talk about prolapse. And in this video, I will talk about what is a prolapse and what can PT do to help. So this will be part of a little YouTube series. Okay, so to start, what is a prolapse? A prolapse is when a pelvic organ, which could be the uterus, that could be the bowels, either like the rectum or the small bowels or the bladder, are falling into the vaginal canal. Okay, and so there are different kind of like grades of that, but essentially what is going on is that for whatever reason, the ligaments that hold up those organs in place have been stretched out. Okay, and that's usually from increased like abdominal pressure. And so some people, we automatically think maybe like pushing out a baby can do that, but so can also like chronic constipation, chronic coughing. It's a lot of like internal pressure on those organs. It's just that pushing out a baby is a lot of pressure all at once. Chronic constipation, chronic coughing is a little bit of pressure, but over the years can kind of like equal out or be similar to a lot of pressure all at once. And so that basically, it's like we think of prolapse and we think of things like falling, those ligaments lengthening, and what that can do is create symptoms such as maybe like urinary leakage. Sometimes that's vaginal or perineal like heaviness and pressure. A lot of people describe it as though it feels like something's falling. It's like they have a tampon in even though they're not thinking about it. Some people will say that it's like hard to empty their bladder, that kind of thing. Some people will describe like back pain, things like that. But the big ones I would say are like the vaginal heaviness, leakage, maybe not emptying bladder. If it's more of the rectum, that could be constipation, like stool is getting stuck in that kind of little like pouch, and then it's hard to empty. But I'd say those are like the big symptoms that like a prolapse could cause. Okay, and just because you have those symptoms, I should say, doesn't mean that you have a prolapse, but sometimes they are correlated. Okay, now the different grades basically, so it ranges from like 0 is no prolapse to like 4 is like full eversion of those organs. So 1 and 2, 1, 2, and like some 3s are probably what I see the most. 1 is just like a little bit of a give, a little bit of laxity. A grade 2 is, going a little bit further, maybe no further than like a centimeter outside of the vaginal canal. And this is by no means, I should say, a way to like diagnose yourself. This is just general information that you could easily like find online. But so a grade 2 goes either to the vaginal opening, maybe just a little bit outside. A grade 3 is more than a centimeter past the vaginal opening, but not fully out, essentially. And so what PT can do is essentially improve it by a grade. So take a 3 to a 2, 2 to a 1. But what we can do, and this is the key part, is eliminate the symptoms. Okay, so eliminate the symptoms of that heaviness that you're having, that pressure, the leakage, helping you empty your bladder and bowels. You don't have to have no prolapse to have no symptoms. And I think that's kind of like what we would think. Even just like logically that makes sense. Eliminate prolapse, eliminate symptoms. And that doesn't always work that way. Another thing to bring up is that 80% of people at 6 weeks postpartum, I believe it's 80%, have some form of laxity. Maybe that's just a little bit. That doesn't necessarily mean like a big prolapse, but a lot of people can have laxity and not necessarily have any symptoms. And so that's why we think every postpartum person like should get a pelvic floor assessment, even if it's just one, so that they know like what impairments are specific to their body and know the steps they can take to prevent like a more severe like laxity or like prolapse from happening. Okay, so basically, to review, a prolapse is the lengthening of those ligaments, the falling of the pelvic organs into the vagina. It can create symptoms of heaviness and pressure, leakage, difficulty emptying bladder and bowels, and PT can absolutely help with those symptoms, okay, with eliminating, again, the leakage, heaviness, and things like that. And it can also help improve the laxity a little bit by a grade. So thank you so much for listening. I hope this helped. Stay tuned for future videos where we talk more about prolapse and things you can do.